All right, speaking of cool, we're ready to get to show you guys some amazing state-of-the-art technology, and this is helping surgeons perform minimally invasive surgery. Like, this could be the cutting edge of technology, something that, like, years from now, this is only the way that you get surgery.
We are at Mercy General Hospital now. Dr. Wilfredo Ramos joining us live, getting a look at a brand new 3D robotic surgical system. Good morning, Dr. Ramos.
Good morning. How are you?
We're doing very well, thanks. Wow, robotic surgery. Now, we've seen a little bit of this, but how is Mercy using it?
How are you guys using it?
How are you using the surgery?
I'm having a little difficulty hearing you. Okay, there you are.
Hi. Okay, we're curious how Mercy General is using this. What kind of surgeries do you perform with the robotic unit?
Show us the surgery you use.
This is actually the Vinci SI HD model. This is the latest in technology from Intuitive. Basically, laparoscopic robotic assisted surgery.
Right, so it's basically the doctor, then the surgeon, puts his head inside that little compartment right over there, just like you're going to do now, and he uses
that is correct.
Right, and then he uses his fingers to manipulate the robotics, right?
Exactly. I'll demonstrate how this works. Essentially, what you're doing is the robot does not do any of the work. The surgeon controls the instruments. The instruments rotate 360 degrees, as you can see. These are very, very small rubber bands that I'm actually manipulating here. You can see the applications in the human body where you can work with essentially anything that is very small and like blood vessels or any other tissues, and it functions just like your hand. You can move your camera around and get in very, very close to the tissues, or whether it be a tumor or blood vessels or anything like that.
And I understand it actually affects recovery time. How so?
Recovery time with this type of surgery, because the incisions are so small, is cut in less than half. So you have patients going home the same day in some cases and back to normal activities in 1 week or 2 weeks, which is unheard of when you talk about procedures such as hysterectomies or removal of fibroids.
So how much training do the doctors need to use this system?
The training is, you have a basic training, if you will, of a course on a facility where they teach you all the ins and outs of the procedure. Then after that, you have to go through a proctoring type of program to where you are supervised by another physician with a lot of experience and has been accredited by the company. Of course, each hospital has their own rules, regulations, etc. But it is very intensive as far as proctoring. And
it really is like it's like almost like a video game. Now, I'm curious, will patients have the option if they have a certain type of surgery? Some people might say, I don't want the robot, give me the actual hands of the surgeon.
Most of the patients, once they hear about the advantages of this type of surgery, definitely don't want to be opened up and have the quote-unquote surgeon in them, because this really simplifies the surgery to a point to where you can be in the patient without actually being there. And the recovery is so much faster.
Yeah. Does it change the cost of the surgery at all?
Yeah.
Not at all. This is covered by most insurances as regular laparoscopic surgery, and it's just one of our tools in laparoscopic surgery.
Well, it's fascinating to watch. Doctor, thank you so much. Dr. Wilfredo Ramos, who's with the OBGYN department at Mercy General Hospital, and this new 3D surgical system they've got here, Da Vinci, which anything named Da Vinci, you know it's got to be good. Thank you very much for joining us this morning. We appreciate it.
That's really, man, that's like the closest thing to playing a video game that you could get in terms of, in the office there.
You're starting to really get into it there. You just kind of was like, yeah, okay, thanks, bye. Yeah. I got to get some more field work here.
I have a robot with attitude, though.
Right.
You need to stop twitching. Stop twitching.
It slapped you.
It is you, aorta.
Right. My fear is that the doctor would sneeze. Achoo. Hey, guys, listen up.
And now surgery apparently has gone to the robots.
Seen a little bit of this, and here's more of it. Mercy General Hospital in Sacramento performed its first robotic-assisted surgery last month. And the results, they say, were outstanding. The Vinci SI-HD surgical system is the very latest in technology for robotics, with several advantages for both patients and surgeons.
The main ones are quick recovery, so the patient usually goes home the same day or the next day. Very small incisions with a lot less pain, less blood loss, and easy recovery afterward to return to activities within the first week or two.
Well, Mercy is one of a handful of facilities across the country offering this minimally invasive and rather innovative procedure. The times have changed. Sacramento Mayor Kevin